We know that from previous studies, there are disparities in transplantation for women, for non-Caucasians, for the uninsured, and for the publicly insured and rural populations. This
Right.
has been shown in not just liver transplantation, kidney transplantation, but overall. What we wanted to do was to take a look at single transplant center characteristics. What is it about some centers that make them be better representative of their of the population that they're serving? Because there are some centers that end up being having their wait lists be more representative of what is called their donor service area. So the area where at least prior to the reallocation schemes that have just been implemented in the last several months, most of their donors came from. The Black population was underrepresented at the vast majority of centers, meaning that the percentage of Blacks in their donor service area was higher, significantly higher than the percentage of their waitlist, of the Blacks on their waitlist. And when we looked at what it was about each individual center that correlated with that difference, what we found was for the Black population, the more the center transplanted people with private insurance, the less they were representative of the number of Blacks they had in their donor service area. So that was one key finding. And the other key finding was that the longer people had to travel or did travel to get to that center for transplantation, the less the center was representative of the percentage of Blacks in their donor service. Interesting question here is, are the underrepresented populations just not getting referred to the transplant centers? Do they have access to primary care that is, one, aware of transplantation as a solution to that population's liver problems? And two, if they are aware, do they know, what it takes to be listed? Are they ruling out patients who may have, Medicaid as their insurance, but think that, just because this patient has Medicaid insurance, they probably wouldn't be eligible for transplantation. Whereas in a lot of cases, I think the vast majority of transplant centers will take public insurance.